Hello, I'm Champ Baker Jr. of the Houston Clinic. Here today to talk about Tenex Health, introduction of the new TX2 needle. The TX1 needle was used successfully for treatment of Achilles tendonitis, plantar fasciitis, epicondylitis of the elbow, medial and lateral, as well as patella tendonitis. However, the short length made it difficult to treat lesions of the hip, specifically tendinosis of gluteus minimus and medius. That problem now is solved. The procedure is done as always under ultrasonic control in the outpatient setting, either hospital or surgical setting. It's done on a local, very well tolerated by the patient, with extremely good results. It's good to see you again. Thanks for coming in.
Thank you.
Now, we talked a few months ago about your hip. Tell me again, it's your right hip, correct?
Yes.
And what kind of trouble are you having with it?
As you know, about 6 to 8 months ago, I started having pain in my right hip, and I was having trouble sleeping at night on my hip. This is the side I sleep on. So I was having some pain as I slept. It would wake me up, keep me up at night. So I came in, and I think we tried some, icing and, moving around more. And then we came back a few months ago, and we tried again to relieve the pain with cortisone shot. And still, that worked for a couple of months and helped a lot. But now I'm feeling pain again. So my commute to work, I get out of the car. Once I get to work, it's about a 30-minute drive. I get out of the car at work, and it's painful to walk. I have to take a few steps before the pain starts subsiding. Okay. And then going up steps, sitting during the day, I have to get up and move around quite a bit. Well,
we may be at a stage now where it's time to change treatment. We did that ultrasound exam and showed you have a partial tear of one of your hip abductors, a gluteal tendon, and also, as a matter of fact, even calcification out there. And the normal treatment has been therapy, the modalities, and injection usually to try to calm down the irritation. If that's not worked right now, I think it's maybe time to shift gears. And I think you'd be an excellent candidate for a newer technique we're doing. Tenex Health has a ultrasound-guided way of resecting and removing the diseased tissue. It's done under local technique in a procedure room. You're wide awake. I'll numb the area up, and then under ultrasound, we'll look and confirm where the area of pathology is and introduce my needle. I inject an energy wave, and it resects the diseased tendon, not the normal tendon, and it sucks it out. And then I put a Band-Aid, and we sort of let you go home and resume activities. It's a nice way to treat a localized area. And I think rather than consider an operation to either scope your hip or open and clean this out, this is definitely, I think, what I would recommend.
Okay, let's give it a try.
Okay, good, thank you. We'll get it set up for you. Okay, good, thanks. Hi, Denise. Well, welcome. Hey. Come in, have a seat here if you would, okay? I'll sit now. Today's we talked about your right hip, correct? Okay, we're going to use our new technology. I'm going to identify it with the ultrasound. We'll numb it up. I'll introduce my machine. You'll be able to watch it on the screen while we do it. We're going to take out that little tendon that was diseased. Any questions at all about the procedure? No. Okay, good. I'll have you lay on your left side facing that way, okay? Okay. And I'm going to go ahead and I'll pull up your dress and expose your hip right here, okay? To begin, the patient is placed in a lateral position. The affected side is pointing up. The ultrasound transducer is placed in an axial or transverse plane over the peak of the greater trochanter. For orientation, posterior is on the left side of the image and anterior is on the right side. Once we orient off the peak of the greater trochanter, we can appreciate the gluteus minimus tendon as it sits anterior. We can see in our patient calcific tendonitis as well via the hyperchoric foci within the gluteus minimus tendon. As you come back over the peak, moving posteriorly and move into a short axis view of the gluteus medius tendon, in this patient it appears a little thick, but there is no obvious calcification or hyperchoric region signifying pathology. We then move back to the gluteus minimus tendon where we saw the pathology and orient our ultrasound transducer to a long axis view of the tendon. We again see the calcifications and surrounding hyperchoric region of tendinosis, which together will be our target area. Before we start the procedure, we clean with ChloraPrep and drape the patient appropriately. Local anesthetic is then provided to the skin and subcutaneous tissue, anesthetizing tract down to the tissue within the tendon. An 11 blade, or depending on the body's habitus, a slightly longer blade is then used to create a tract down through the skin to the targeted tissue. We then insert the T2 MicroTip following the tract created by the blade down to the tendon and to the region of pathology. Once we have the targeted tissue, we activate the TX2 MicroTip by depressing the foot pedal and use a back and forth motion which will optimize the ability to cut and remove the targeted tissue, which has been identified as a hypercoic region within the tendon. The TX2 microtip may need to be redirected in a different plane along the long axis of the tendon, but it should never be moved in a sweeping or side-to-side motion. The TX2 microtip should always be maneuvered in a forward and backward direction. When attempting to shave calcifications, the TX2 microtip should be used to shave down the calcification from the periphery of the calcification inward. It should never be directly lodged into the calcification. The goal in treating the hypercoic pathology is to reduce or remove this targeted tissue, as well as appreciated reduction resistance during the procedure. This is indicative of cutting and removal of tissue. To complete the procedure, the TX2 microtip is removed, the patient is cleaned, stair strips are applied, as well as an occlusive dressing.